Hello, I'm Beth Britton. I support Dementia Community with their communications work. Welcome and thank you for joining us for our 2nd October webinar. Before we get into the topic for today, I wanted to briefly explain a bit more about Dementia Community. Dementia Community is a charitable community benefit society, a membership cooperative that provides learning and networking opportunities for the dementia care community. We are an independent voice and inclusive organisation aiming to help all of our members to feel connected, informed, inspired, empowered, purposeful and engaged in co-produced changes that improve everyone's experiences of dementia, both in care and in wider society. This webinar is just one example of the many ways in which we do this. Community members own a £1 community share in Dementia Community, and membership is open to everyone. If you aren't already a member, do join us. You can use the QR code on your screen or the link that will shortly be in the chat to visit our membership page. If you're having any difficulties in joining Dementia Community, please do message myself and I will aim to help. One of the benefits of being a member is a discount to our in-person events, and the countdown is now on, less than 5 weeks until our UK Dementia Congress, now in its 19th year and being held in Manchester on the 17th and 18th of November. The programme is fantastic, not to be missed, so please do scan the QR code or visit the link in the chat to grab your ticket. Excuse me. I'd also like to highlight a new initiative that we have begun, the editor's pick from the Journal of Dementia Care. This is a free article chosen monthly by the JDC editor, shared to give you a taste of the content of the journal. Please do use the QR code to read the article or the link that is in the chat. Remember that if you are a member, one of your benefits is a 25% discount on a subscription to JDC. So if you enjoy the editor's pick, do consider subscribing. We also have 2 free special issues of JDC available: Equality, Diversity and Inclusion, a special issue, and Celebrating the Arts in Dementia Care. Again, please use the QR code on the screen to read those issues. We will also share an email address in the chat for you if you would like a hard copy of either of these publications. So please do email us if you would like that following those instructions. Please do note that aside from these special issues, the Journal of Dementia Care is a digital-only publication. So, on to our topic for the webinar today: connecting you to support integrating rehabilitation for people with dementia. We are recording this webinar, so please do not put your face on the recording and turn your camera off. Please use the chat for your questions. We will be doing a Q&A that will be through the chat. Our presenter is also going to post some questions through the chat, so do find your chat button because you're going to be needing it. And afterwards, this recording will go on to our YouTube channel, which is Dementia Community. So without further ado, then let me get us started and introduce our fantastic speaker for today. So Elaine Hunter is the National Allied Health Professions Consultant, Alzheimer Scotland Visiting Professor from Edinburgh Napier University. Elaine, it's wonderful to have you with us. Welcome, and over to you.
Thank you. I'm just going to start sharing my slides with you. Don't know why it's jumping to that one. That's good. That's the one I want to see. So thank you for joining me all this afternoon to a rearranged sort of webinar, and to Beth and the Dementia Community for the invitation. I'm particularly excited because it's 14th of October and it's our International Allied Health Professions Day. So it's great that I could do this on this particular day. The work I'm going to share with you today is commissioned by Scottish Government and funded by them and hosted within Alzheimer Scotland. I need to say from the start, well, my name's on the slides, and a number of different ways you can connect with me. You can see them all there, so please take a photograph if you want to sort of get in contact with me with the webinar. But the work I'm sharing with you is the work of many amazing and inspiring colleagues who all support and drive this work in partnership in Scotland, the United Kingdom, and indeed internationally. My slides can be shared later if you want them, and I've got a few QR codes, so have your camera ready, and please take some photos if you wish. Okay. So who's Elaine? Let me get started and tell you who's presenting to you today. I graduated from St John's, York in 1985 as an occupational therapist. And you can see the image of me on the left-hand side in the middle. In my 40-year career, I worked in the NHS, Scottish Government, and more recently, third sector. My roles and areas of clinical practice have been wide and varied, from acute mental health to psychotherapy to forensic psychiatry as a clinician, practice educator, AHP manager, AHP leader, and now as an allied health professional in a national strategic role. And you can see me there on the right. I was very excited with that celebration event at Scottish Parliament. However, I'm more than my work, as we all are. My roles in life are many, and the most significant one are that of mother, wife, sister, auntie, great auntie, sister-in-law, friend, and importantly, a dog owner. My learning about dementia has been at university, from practice, from peers, from people with lived experience. However, my greatest learning was my own lived experience as a carer from 2012 until 2022. And you can see the QR code in that slide. And that's the blog I wrote called Transition, Daughter, Carer to Care Home Visitor. So I've just said a wee bit about myself, but I'm really interested to know who's in the room with us today. So Rod's going to invite you, and Beth's going to keep an eye on the chat for me, just to drop in the chat who's in the room, who's joined us today. Are you an allied health professional, sort of health and social care professional, an academic, a student? Are you living with dementia, supporting somebody with dementia? It'd be really nice to see who's there. And Beth, hopefully you can let me know.
I can, Elaine, thank you. So we have an Admiral nurse, we have a physio, another physio, first year OT student. So you're talking to the next generation, Elaine, which
Brilliant.
is lovely. This is going to go super, super fast, I'm sure. Lots and lots of OTs, actually. I can see quite a few. Speech and language therapist. Lots and lots of OTs. This is definitely an OT happy place this afternoon. Lots and lots physios and OTs, AHP working with dementia patients, lots more OTs, mental health nurses, another speech and language therapist, people from Scotland, people from Wales,
Brilliant.
lots of OTs. You've definitely pulled the OT crowd this
Okay,
afternoon.
that's great.
I
Good,
wonder if we've got
thank you.
any OTs working anywhere this afternoon. Actually, I
That's
think they're
great.
all here. We've got
Oh,
someone from Belfast as well, so we've reached
great.
into Ireland as well, which is fantastic. Northern Ireland, welcome. We've got rehab team, an assistant practitioner, support diagnostic dementia support worker, somebody from the Royal College of Occupational Therapists as well. Lots of people working in different, it looks like quite a lot of acute care, quite a lot of sort of
Okay,
healthcare based roles, a dementia treatment nurse. Yeah,
great.
substance misuse occupational therapist specializing in
Okay,
alcohol related brain damage. So yeah,
great.
we've got a really varied team with us today. A dementia advisor from the Alzheimer Society as well. Another dementia advisor, some more students. Yeah, there's absolutely loads, but I think that probably OTs is my definite sort of. We've got someone who's retired as well, and I know from looking at the list of participants, so I know we've got at least two people living with dementia as well. So
Great.
we do have some
Okay,
people with some
thank you.
experience.
Thank you. I'll just try to move the slide.
Got someone who's
That's it.
retired
Okay,
and neurorehab as well. Yeah, lots and lots of super professions in the chat. Lots of experience on the call.
great. Thank you. In my time with you today, I'm going to share our experience in Scotland of developing a national allied health profession policy that seeks to ensure people living with dementia and their families have better access to allied health professionals. During our time together, I'll share a whole system tailored AHP delivery model that incorporates rehabilitation, the evidence base, and tells a story of transformation of accessible and visible AHP knowledge and skills. However, at the heart of this presentation, and I often say this when I'm doing presentation, it's really about partnership working, community connections, engagement, and a story about people values, rehabilitation and leadership, and most importantly, the voice of lived experience. So who are allied health professions? And I know there's a few of you on the call today. But in Scotland, there are 14,000 allied health professions from 14 different AHP professions. And within the United Kingdom, what makes up an allied health profession actually varies in the four different countries that make up the UK. But it does make us the largest clinical workforce, with approximately 500 working in the community and up to 250 in primary care. We describe ourselves as being at the forefront of rehabilitation, early intervention and prevention, leaders and advocates of change, working across health, social care, public health, education and third sector. While we've always described ourselves as a group of professionals who can lead on rehabilitation, and rehabilitation is a core pathway for many neurological conditions, as a pathway option for people with dementia and their families, it's still new and evolving. So it's great to be talking about it today. To put all our work into perspective, I'd be suggesting to you it's really important to be aware of your national and local context, and I will start there. We have policies in Scotland where rehabilitation is integral to how we deliver services. We have a rehabilitation and recovery policy which presents a once for Scotland approach, ensuring rehabilitation is personalised and outcome focused. We have a dementia strategy in Scotland. It's our fourth one. Our current one is a 10-year vision for change, developed in collaboration with people with lived experience and integrates rehabilitation as a support option after a diagnosis of dementia. We have the Health and Social Care Service Renewal Framework supporting the need from implementing the Once for Scotland rehabilitation approach as part of population planning, drawing on our existing rehabilitation and recovery framework that you can see in this slide. And I guess I just want to pose to you, and not in the chat, but just to think about and reflect on, what are the policies and strategies that support rehabilitation in the context that you work in? So how have we integrated the emerging evidence base of rehabilitation into practice in Scotland for people living with dementia or supporting somebody with dementia? Let me take you back to 2013. Our second dementia strategy in Scotland, I was commissioned via Alzheimer Scotland to produce an evidence-based policy document outlining the contribution of allied health professions as a commitment in that strategy you can see on the slide. We delivered this in 2017 and then had two follow-up reports. The one we developed in 2020, we had an exciting launch event in February 2020, and as you all know, in March 2020, COVID came. So the report from 2020 to 24 is really an interesting report, and I'd encourage you to have a look at it. Just what did we do during those times of change during the pandemic? Throughout the three reports, we continue to call the policy Connecting People, Connecting Support, because that's literally what we were doing. We're connecting people with lived experience to support we can offer as allied health professionals. All the policies are in partnership with Scottish Government and Alzheimer Scotland, where we integrate the evidence base, provide a vision for change through 4 co-designed ambitions or recommendations, and we inform people what to expect from an allied health professions. In all the reports, we've integrated rehabilitation from the very start, and also the emerging evidence base. All policies, the 3 policies you can see on the slide, seek to ensure that people living with dementia and their families have better access to allied health professionals, regardless of age or place of residence, setting out how AHPs and services can be remodelled. In the third report we published last November in 2024, Connecting People, Connecting Support, Looking Back, Looking Ahead, we split it into 3 sections. And we began by looking back, the story so far. Where did the policy journey begin? You can see on this slide, to transform the HP contribution in dementia, it started well before a policy was written. In 2013 to 2014, I established a national HP dementia community. We shared our work on social media, on both X and as a blog, and we worked with the universities and our allied health profession students on practice placements. And there's lots of other examples in that slide, but I won't cover that today, and you can always get in touch if you want to know any more information on any of the work. I was invited to write an evidence-based policy, and we've continued to do that throughout the whole 3 policies and the work we do. In developing all the policies, we've informed them by three sources of evidence. In conversations with people living with dementia and their families, using appreciative inquiry, what's worked, what more, and then sort of cascading what people are asking for and sharing that information. Collaboration with health and social care practitioners, including our higher education institutions, and holding local and national engagement events, and research and scoping evaluation and literature reviews, which was really important too. Using these three areas of evidence, they provided us with a rich foundation to design our AHP approach that you can see on this slide just now. In connecting people, connecting support, we define our evidence-based AHP approach as underpinned by human rights principles and a biopsychosocial approach. While the key areas are described separately, they need to be implemented together and throughout the allied health profession offer, regardless of which AHP profession you come from. The evidence told us, and continues to tell us to this day, people are asking us for personalised, tailored interventions delivered in their local community in their own homes and with the support of family and friends. But if we move to rehabilitation, what does this policy look like in practice, and how do we do it? And at this point, I just want you to have a think about, and it's a question we're asking ourselves with the allied health professions in Scotland and also our colleagues in Wales. Again, in the chat, Beth, just actually, if people were to describe rehabilitation, just one word to describe rehabilitation, what would it mean to you? What does rehabilitation mean to you? In the role you're in, your current life, your family experience, if you've got lived experience, either as a person with the diagnosis or supporting somebody.
Super, thank you, Elaine. So far we've got independence and empowerment. There's going to be lots of votes for independence, empowerment,
Brilliant.
doing the things I want to do, return to baseline, keep on going. Enablement is another really good word as well. Regaining hope, abilities to reach goals. Goals, of course, really, really important with rehabilitation. Personalised care, doing, patient-centred goals and aims, enabling individuals to lead their best life, improvement, strength, recovery, progress, regain, maintain, compensate. Abby, you went for three.
Brilliant.
Ability to carry on doing what I can do. Lots more votes for enabling and independence, wellness,
Brilliant.
progress, and improvement, doing what's important to people, achieving full potential, meaningful activities, some votes for that, acceptance and understanding, being seen as me, not my diagnosis. I think that's a really interesting and important message.
Great.
Level of function, mobility to maintain current level or improve level, to keep social interactions going. Another vote for quality of life, individually tailored help, able to help with my mental health, well-being, to continue to do what's important. More votes for best life and doing what matters to me, control over my own life, reaching maximum achievable functioning, to continue to lead my best life, and from my lovely society secretary on the call today, choice and autonomy. So a
Brilliant.
really big there, Elaine.
Thank you. Thanks folks for joining in. And it's a question I'd encourage you to take in and forward from this webinar, because the more we talk about it, the more there'll be understanding as to what we're meaning and what that looks like if you've been diagnosed with dementia. We're in a really good position just now, and we were really excited when the Alzheimer Disease International developed this report. Reimagining life with dementia, the power of rehabilitation. If you haven't seen it before, the QR code hopefully works for you. And I joined the webinar when they launched it last month. When you go into the document, it's 143 pages, so please take your time, split it up. You've got a student on placement with you, get them to sort of critically appraise it for you. The key messages, some of the messages I took from it, was rehabilitation offers hope in the absence of a cure. Rehabilitation should be a right. The core components include person-centred, goal-orientated and collaborative. And one post-diagnostic intervention that remains relatively unknown to health and care community as the wider public is dementia rehabilitation. So it gives us opportunities to sort of go in and look at sort of opinions and ideas. The report is truly global with some lovely and inspiring examples from the UK. There was a call out, we were very excited. So for some of our work in Scotland on pages 119, 120, as a result of our collaborative work with my colleague Natalie Elliott in Wales and Michelle in Australia. But I would encourage you to have a look at it and sort of just have a think, what does this mean to me in the role I'm in, or for somebody and the people that I work with? We've been speaking about dementia rehabilitation with the allied health professions in Scotland for a while now. And we started doing a series of blogs I'm going to come back to. And we're literally just asking people, actually, what does rehabilitation mean to me? And the QR code will take you into the blog that we post every week. And the blog that's there, it was written by the speech and language therapist. And she gives a lovely case example of what that looks like when she's working with somebody with lived experience. We also asked some of our members of the Scottish Dementia Working Group, because people with lived experience in the Scottish Dementia Working Group, when we were working with them, asked us a really important question: what do you mean by rehabilitation? And the quote that's on that slide just now was from Ian. And his idea is, when you're talking about rehabilitation, it's learning new ways to cope with having dementia, and what's our responsibilities for each of us to support people to achieve that goal of learning new ways to sort of live with the dementia. To integrate the rehabilitation evidence into practice in Scotland, we've adapted and designed a delivery model you can see on this slide. The terminology of universal, targeted and individualised specialist is familiar to allied health professions across the United Kingdom. This whole seamless approach provides a platform where which allied health professions services can respond to what people living with dementia are asking for now and in the future. We originally had it as a triangle with universal on the lower layer, then going up to the individualised specialist, but we moved that because we feel with the circles it replicates that journey that people will experience, and there's times they'll need an allied health professional, and there's others where people will manage really well to self-manage with the right support and self-management experience from us. What I'm going to do now is actually sort of bring that universal targeting and individualised to life for you, and how we've done it and how we've approached it. And bearing in mind, we've been doing this since 2017, since our original report got published. So for Universal, our ambition is to ensure people with lived experience are accessing information and resources in a variety of formats to help me self-manage. Self-directed rehabilitation was how it was described by ADI. We've explored digital opportunities to increase access to evidence-based, allied health professional-led self-management resources, while also evaluating outcomes and impact. The resources are all available on one website, Alzheimer Scotland, that you can see on the slide, and the QR code should work. We have print-out versions that are also available that we know are being shared in our local communities in Scotland, are available for our staff in Alzheimer Scotland, and more recently our Alzheimer Scotland conference that we had last month. We have conversations with people with lived experience, and we therefore develop resources based on need and what our core skills as a group of allied health professions we can design and develop. And you can see some of the examples on the slide. So we have allied health profession badges so you can identify them. When you go into the website, you'll find postcards with speech and language therapy. You can define what a speech and language therapist can offer you. We've got information sheets, sort of foot care at home, written obviously by our podiatry colleagues. We've got some really nice, practical, easily understood sort of physical activity and exercise ideas written by our speech and our physiotherapists, tips for talking written by our speech and language therapists. Tips for eating and drinking, again, written by speech and language. Practical tips to help my memories, a really nice practical resource developed by our occupational therapy colleagues in NHS Lanarkshire. And connecting to youth support booklet looks like the one you can see in the slide. And there's lots of different examples in there, again, sort of practical self-management advice that's actually wider than just allied health professions. There's examples in there sort of about hearing, including sort of audiology and other areas as well. Really worth having a look. And we've developed these resources. And really importantly, they're all free. that you can download, print off, use. And if you think there's gaps or anything that we're missing that you find helpful written by an allied health profession, then my email's at the end and you can let us know. The other area around Universal is from an allied health professional point of view. We're sharing our knowledge and skills to enable you to make informed choices. We also have this website that we developed in 2020. It's an interactive website. We called it Connect to People, Connect and Support Online. You can see the connection. Designed to help you embed health promoting activities in your daily routine. When you go into that website, again, the QR codes, you'll find 32 folders, and in each folder there'll be things to chat about, try, play, and more. Half of the folders we designed something to do at the weekend, and then half, about 16 of the folders, are likely to be things an occupational therapist in particular might do with you if they were actually in a room and you needed that occupational therapy rehabilitation. It's a really nice resource. We're really proud of it, and we keep an eye on the statistics, and we know people are looking at it, and we respond to comments. Last year we put in some new folders. It always sticks to 32 folders about lifestyle matters. That's about brain health. We added in a folder about culture, which was one of the comments we received. So that was really important. Go and have a look, and we'd love to know what you think about it. And then when you move to targeted, at this point you're accessing tailored consultation, support and education. So you might be in a room with an allied health profession, but with other people. And from an AHP point of view, we're supporting people to build knowledge, skills and confidence to improve your experience of care. One example, we do AHP dementia webinars, not the same time as your ones, Beth, so it'll be fine. We always run ours at 3:30 to 4:30. We've got a couple coming up. But when you go into the QR code, when you scroll down the bottom, you'll find a range of dementia webinars, AHP dementia webinars that include people with lived experience. So driving in dementia is always a really important area for people to sort of have a think about. Our stairless and cognitive impairment, we've had huge a lot of people looking at that one. Our podiatrists are talking about how they've used talking mats with people as well. And we've got other examples, so please go and have a look and see what you think, and then you can join the other ones that we're having again later this year. Targeted also includes education sessions with our colleagues, whether it's a community psychiatric nurse, with sort of carers in sort of carer cafes or carers academy. Community appointment days was an example that people did in Aberdeen recently. These are there's quite a few allied health professions available in a community setting, and people came and found information. And what we do at this stage, we're integrating the resources into our conversations and therefore tailoring what is signposted and shared with people's lived experience. So it's about actually just those fine words: consultation, support and education. And then we move to individualised, and at this point people are actually in a room with an allied health profession receiving that rehabilitation that they need. So you're receiving personalised assessments, rehabilitation, enablement delivered by an allied health professional and only delivered by us. The examples on the slide are two occupational therapy examples that are taking place within Scotland. We're also aware of them taking place in Wales as well. Both a post-diagnostic intervention, you'd set goals, and individualised strategies are monitored and evaluated. So on the left-hand side is our occupational therapy home-based memory rehabilitation that we've been doing since 2016, and it's a cognitive rehabilitation approach that takes place in a person's home, talking through use of internal memory strategies, memory aids, environmental adaptations. It's delivered on a weekly basis and family carers involved. The journey through dementia on the right-hand side we've been doing since 2018, and it's an occupation-based peer-to-peer group intervention that takes place in the local community, and it's menu-led and personalised. The interventions are evidence-based, co-designed. We have high quality resources, because that's really important, because I firmly believe when you give somebody quality resources, you're immediately saying to them, you really matter. You really matter in this intervention and our time together. I'm using improvement methodology supported by a measurement framework to see if we've made any difference. Ron, we're going to put a poll up just now, just really to see after today if people are likely to go and have a look at the HP self-management resources that we've shared. So it's been really quick when I've gone through them. I just wanted to sort of just look. But after today, will you access the HP self-management resources that I've shared with you today? Not likely, somewhat likely, and very likely. Well, that's good. That's a relief. That's a relief, Beth. I can see 83.
Well, I was going to say, just while people are doing the poll, I've been scribbling away with some notes because we have a resources section on our website. We also have an event section, and I'd very much like to be sharing more of what you're doing because it just sounds fantastic. And I didn't actually realise the full extent of all the resources that you'd created, Elaine. So this has been very informative for me as well, and
Great.
very, very useful. But yeah, the vast majority of people are saying they're very likely to go and have a look. I've been popping a few links in the chat as well so that
Great.
people
Thank you.
can't scan the QR codes. They can go and have a look in the chat and grab the link from there as well. But
That's
yeah,
great.
very likely, 79%, very likely to go and have
Good.
a look.
I'll take that. Thank you. Okay, I'll just carry on with the presentation. Okay.
Super.
Okay. That's it. Okay, thank you. So to integrate rehabilitation to every day, how could you do that in your job, or if you're living with dementia or supporting somebody with dementia? I want to just reflect on it. It's not one thing, it's a coming together of many things. In the new ADI report, this is what they describe as system readiness for rehabilitation on page 109. I've covered a number of these already, and I'm just going to build on these and share our approach that we've been using in Scotland, and you may already be doing it in your own roles as well. So to integrate rehabilitation into everyday practice is understanding the policy context, what policies influence your work and the part of the UK or wherever you currently work. The evidence-informed AHP approach we use all the time in Scotland and have since 2017. We look at the emerging evidence base, we review it. We've built on our work around the evidence base, obviously using the ADI report and our up-to-date literature review that our colleagues in Wales did in 2022, and our quality improvement journey for everything we implement, particularly around the specialist individualised rehab offer. We use an improvement model. We will look at what we're trying to accomplish, how will we know the changes and improvement, and what change can we make that will result in an improvement. But none of the work I've shared with you would be possible without a co-design and collaborative approach. It is the work of many innovative and dedicated people, including people with lived experience, researchers, clinicians and practitioners. We continue to have a national Alzheimer Scotland Allied Health Professional Dementia Forum who lead the local delivery of universal, targeted and individualised rehabilitation in their local services. As a group, we share and spread best practice. We meet once a month, always the last Thursday of the month, taking a Once for Scotland approach, with the overall aim to prevent inequalities and access to our expertise as much as we can with the influence that we have. And you can see on the slide that some of us at our Alzheimer Scotland conference last month hosting. So the resources I shared with you, we take copies and we have conversations with people with lived experience and sort of health and social care staff as well to make them accessible. And we also collaborate closely with our colleagues in Wales. We also have our AHP framework. And that collaboration is really important for us. My second area that I want to highlight about integrating rehabilitation and making it happen is training and education of the current and future health and social care workforce is key. I began this work in 2014, developing allied health profession student practice placements and academic internships between local authorities and Alzheimer Scotland. No, local universities, excuse me, between local universities and Alzheimer Scotland. We've published a number of evaluation reports on the work, including the evaluation of our allied health profession MSc rehabilitation module, our CPD on rights-based rehabilitation, We've recently completed a scoping review with our 7 higher education institutions that offer AHP pre-registration programmes that I presented at Alzheimer Europe last week, and we've published a textbook that you can see on the slide just now. Building workforce capacity, skill, knowledge and understanding of dementia rehabilitation is key, particularly for our graduates of the future. And we also need research to build quality evidence in dementia rehabilitation, and that book offered us one way to do that. But the most important bit, to indicate rehabilitation, to make it happen, is really listening to the voice of lived experience, our expert by expertise. I have absolute privilege and honour to work with and challenged by and supported with the Scottish Dementia Working Group and the National Dementia Carers Action Network. And I've just offered 3 examples of some of this work on the slide. This Stuart's story on the left-hand side is a video that's created by Stuart Dougal, who's also on the Scottish Dementia Working Group and the European Dementia Group, who worked with a physiotherapy student at one of the local universities. Stuart was really keen to share his idea of his hints and tips of living well with dementia, and they created this video together. He then shared that at Alzheimer ADI conference, and he also wrote a blog with the physiotherapy student. It's a lovely piece of work, and that's the video there on the slide. And I'll share all these things on social media for people if they want to sort of have a look at them. The second piece of work I'm sharing there is a information leaflet that 2 occupational therapy students did with the Scottish Dementia Working Group and the National Dementia Carers Action Network, Travelling with Dementia, that we just published and we shared at the conference last month. And the booklet's lovely because it's actually not really about travelling. They really pick up that travelling is more than just getting A to B. It's about independence, adventure and connections. And in many ways, how most of you described rehabilitation. It's not really about the train, the taxi, the ferry or the tram. And then we're also working with our 2 active voice groups on research. And that's an image you can see there of Maureen from National Dementia Carers Action Network forming a clear bond with one of the sort of robots that we did. We're working with the 2 groups in an existing piece of research with Edinburgh, Napier University and Heriot-Watt University in a study that's co-designed project to really look at the views of people with lived experience on the use of robots in dementia and to understand if robots can support meaningful person-centred participation in everyday activities to enhance rehabilitation outcomes in dementia. But I couldn't do any of the work that I'm doing without being informed and guided by the voice of lived experience. These are just 3 examples of how we'd work with the students, the lived experience, and also with people with our local universities. And as the ADI report says, rehabilitation offers us hope, and hopefully that's what we're doing and a lot of the work we're doing just now. However, despite all the amazing work that we've shared and the progress we've made, key areas of change outlined in people connecting support in the 2024 report, we've not been fully delivered, and that's due to a number of different reasons and not just about allied health professions. And we shared that in our 3rd report, just being realistic actually, what can we do and how much more do we need to do. We know from people's lived experience access to allied health professions expertise remains fragmented and complicated to navigate. We still need to increase awareness of what dementia rehabilitation and how it can lead to better outcomes. The aspiration that dementia is every AHP's business, which is what we said in 2017, has not been fully achieved. And we still have work to do for a skilled AHP workforce in graduation. And allied health professions working in and contributing to dementia care are not always visible and equal partners, and our leadership in services is variable, and research continues to be important. And you can see the quotes from Margaret from Scottish Dementia Working Group and Thea from the National Dementia Carers Action and their ask of us. Looking for systems and processes that recognise needs in person-centred public policy. And Thea's asking us that wishes are rights, that we listen to carers who have a clear understanding and agreement of the wishes and rights of the people that we support. Not huge asks and things that we should be able to deliver on. But our implementation gaps that we recognised in 2024 and wrote about have provided us with our renewed focus and motivation for further action over the coming 24 months. We're going to continue to promote the allied health profession role in promoting good brain health and supporting lifestyle modifications. We're continuing to develop our understanding of what's important to people with lived experience in our local communities simply by speaking to them and asking them that question, what's important to you? Our Alzheimer Scotland AHP Forum continues to meet and pivotal ensuring that those who provide services understand and respect the rights of people living with dementia and their families. And we continue to work with our higher education institutions to share good practice. There's no room for silos in dementia care. And we have a series of blogs that we're doing over the next 12 months, just simply asking people, what does dementia rehabilitation mean to me and mean to you? And contact me if you'd like to sort of write a blog. Happy to do that. And the QR code that's aligned there should take you to our blog site that we post every Thursday as well. We're going to continue to ensure our digital solutions are integral to the work of Allied Health Professional Dementia Programme. We're updating the resources and we're sharing them creatively, and it's a great opportunity to just share with you these resources. Again, the QR codes are there, so that takes you, the second one takes you to the postcards, the leaflets, the HP-led information, and then the third one takes you into the interactive website that we've called Connecting People, Connecting Support Online. And then just finally, so please get all your questions ready for Beth to sort of have a look at in the chat. Connecting People, Connecting Support has been successful in developing visible leadership, both local and nationally, with enhancing access to rehabilitation directed by AHPs at its core. For people living with dementia and their families, we have raised awareness of the allied health professional role, informed people who we are and how we can help, and always been mindful that services are much more effective when they're coordinated, integrated, and working in tandem with people living with dementia and their families and supporters, and calls for a multidisciplinary, multi-sector approach in which AHPs play a unique part. We have the voice of lived experience front and central in Scotland, and here you can see on this slide, Thea, while supporting our launch of the third report last November, she's also challenging us to close implementation gaps I mentioned earlier. The recent ADI report, the Alzheimer Disease International report, concludes rehabilitation can be implemented via a whole team of allied healthcare professionals, or it can be devised by a person living with dementia and carried out with the help of their informal support systems. In the continued absence of a cure, rehabilitation is an avenue we have a collective duty to pursue. So I leave you with two questions to consider and reflect on. How can the ideas I have shared today be applied to you in your role, your work, or if you have lived experience? And what is your first step to make it happen? That's all my contact details there.
Super. Thank you so much, Elaine. That's been really interesting.
Stop sharing, Beth.
And I was just going to say, I think my little action to take away is definitely to make sure we get more of those resources onto our website so that they're available to everyone who comes and sees our website and looks for things through us. So we have got time for some questions and answers, and I'm sure there's going to be quite a few. I've seen some things pinging up in the chat already. So just so anyone wondering about the slides and how you're going to get hold of these, just to say they will all be on the recording that will go on our YouTube channel. The link is in the chat. It is on our website as well. It's in the top nav bar as well. So you will find the YouTube recording quite easily, and all Elaine's slides will be on there. And of course, you can scan those QR codes that way as well. So there's been quite a lot about what is there in England, Elaine. So should we tackle that first and foremost? And I don't know if you know the answer to that, but I've seen more than one question that said, what's happening in England? What's available?
Yeah, I don't know, but what I would encourage you to do, all the resources I've shared, they cross any border. And can be used because actually we just happened to write them. Our colleagues in Wales have adapted the postcards into Welsh. It's great. I love seeing the postcards in Welsh. So there's that collaboration. What I would encourage you to do if you're in England is please get in touch with your professional body and ask that question to them. So there's similar work in Wales because the professional bodies, so the Royal College of Speech and Language, Chartered Society of Physiotherapy, Royal College of OT, they collaborated and worked together to ask it to be included within their dementia strategy, that level of leadership. So I'm not 100% sure, Beth, but that's what I would encourage people to do, is to ask that question or to ask their Chief Allied Health Professional Officer in England.
Okay, so I think that's great advice if you're an AHP colleague. If you're a person living with dementia, I guess it's ask that question of your memory clinic, your
Yeah,
GP, that kind of avenue. I think a lot of people are going to say we're just not going to get any of this. It's really frustrating. I think one of the underlying problems here is there's not enough AHPs.
yeah,
OTs, for example, would be intrinsic to delivering rehabilitation for people living with dementia, supporting people with adaptations to their home environment, all of that kind of stuff. And there aren't enough, are there? I mean, what's the deficit?
yeah.
Do you know the figure for that? I know it's
I'm not,
big.
yeah, I'm not sure. And I think probably the reason we deliberately have done the universal targeted and individualised model, because when I came into post in 2012, there was no self-management information that was speaking to people with dementia or supporting people with dementia. So that's our way of trying to, I can't influence the number of allied health professions we're going to have. That's not my decision. But what we can do collectively as a group is design and develop good quality evidence-based self-managed information that people can rely on. And there's lots of information. There's other information out there as well. We're not the only ones doing it, but just that we can do. Again, I'm not 100% sure of the numbers, Beth, but
Yes, if you're
that's our answer, to try and ensure people have that support. And I guess we want to equip people, so if things aren't working, that they can go to GPs, primary care, and say, I need to see one. Um, I need to see a physiotherapist, and to know why they need to see a physiotherapist, speech and language, podiatrist, dietitian. But yeah, yeah,
I think that World Alzheimer's report, I mean, it's relatively new, isn't it? It was
yeah,
only
yeah,
last
yeah,
month. I'm hoping that is going to create a bit of a sea change in terms of the fact that the people that want to campaign for this now have something really concrete to say,
yeah,
actually, this is what has been said. Now we need to be doing this and we need to be really pushing it. And I would just add on that report as well, there are 4 fabulous little infographics that were created as
yeah.
well. So if you prefer your information in a more distilled, clear, pictorial format, they are really, really useful as well. Right, let's get back to the chat. So, what proportion of people living with dementia in Scotland get rehabilitation support? Elaine, have you any idea on a number?
So I only know, do you know, I think if they've got access to allied health professions, each of them will be they will be getting rehabilitation. I don't know the numbers, Beth, because I'm not to get data on the number of valid health professionals we have in Scotland. I've just got that global number that I put up, the 14,000. It's difficult to quantify the actual numbers. There will be gaps, which is what I've identified, and we put that in the report. And it's really important to put the gaps in, and that people still have struggled to access us, because I know, because people come to me and they say they phone up the helpline. But Scottish Government encouraged me to put those gaps in, and that's where we I've worked really hard as an HP community to ensure that we're in the dementia strategy, because it needs to be it's bigger than allied health professions. It's actually about making sure people have support at the right time, from when they want it, and what they need. So hopefully we're part of that bigger picture. So I'm not really answering numbers wise, but that's what we do as
But
much
as
as we
you say,
can.
it's not going to be universal, and there are going to be gaps. And it is,
Yeah,
as you say, important to identify those gaps because otherwise, what do we work towards? What do we say is improvement?
yeah,
So,
yeah,
okay, so I've got someone saying we're so lucky to have you in Scotland. Being part of the Dementia Forum is transformational. Another question around waiting lists. I don't think you're going to really be able to answer this. Where there is rehab, the waiting list can be far too long. I had someone who did a SALT assessment and the wait was 6 months. They had several
yeah,
issues around aspiration. So we know there are waits, don't we? We know this is an issue. They don't say whether that's England or Scotland, but I think there'd probably be issues probably everywhere. There's probably
yeah,
a reflection on that,
yeah,
isn't it?
yeah. And I
Um,
would really encourage people to go to professional bodies.
yeah.
So to go and get in touch with. Again, they can't change it, but they can campaign,
Yeah.
and just see what difference it could maybe make.
And we all have to be on that. I've long been an advocate of rehab because, as you said, there is limited drug interventions that people can access. We know that the new medications that have been licensed are not available in England or Scotland on the respective NHSs. And actually, what gives people hope, and it is being able to work on things like rehabilitation programs that really
Yeah,
helps
yeah,
people with that. Somebody's saying it seems an incubator is the way forward, joining up people living with dementia and their care partners, living in the gap, researchers standing in the gap, and practitioners are bridging the gap. And there's a little link there to a website around that from the NIHR. So
great.
maybe incubators is the way forward. People are saying thank you very much, which is lovely. Lynn saying I'm an OT in Scotland and happy to make connections with any AHPs in England and collaborate. And absolutely, I think we would encourage people. Please do share details in the chat, private message with each other. Please don't put anything in the chat that you don't want the rest of everyone on the call seeing. But please do collaborate. Absolutely. Kate is saying she's a retired OT. More specialists are needed. My application is in. There's an Anna Chaplin, which I presume you might know what that is, Elaine. I don't.
No,
So, Lynn is saying if we have an incubator, I prefer a separate group for those actually diagnosed with dementia. We far too often get spoken for, often with the best intention, but it is not our voice. That's a really interesting point, isn't it? And this was a little conversation I was having in the chat with somebody else who's living with dementia on the call today, that actually it's very important to gather the voice of lived experience, but when you're living with dementia, it's a different experience to when you're
yeah,
supporting someone, and that needs to be recognised, doesn't it? I
yeah.
presume in your work you've worked with people in different ways depending on what their role is.
I do. So, I mean, I've got the privilege of working with the two campaign groups that are in Alzheimer Scotland. So, the Scottish Dementia Working Group and the National Dementia Carers Action Network. And also, we've got allied health professions out in the local communities working with people that aren't campaign groups. So, we we've different ways of asking people what's important. Absolutely. And everybody's at different stages and everybody wants their needs are individualized, and that's what the research says, and that's what people tell us they want as well, actually. And that's where the tailored and personalized is so important. We can't really prescribe. It's like I often see the HP self-managed resources a bit like a shop going into a supermarket. You need to just pick where you're at that time, and at that point, knowing when you really need to be seeing somebody, and supported to ask to see somebody. Yeah,
Thank you, Elaine. So George is saying the Ideal study has produced a booklet on cognitive rehab in practice. That sounds
yeah,
like a very good one to go and have a look
yeah,
at.
yeah,
The length of time people wait for a diagnosis means there may be a loss of opportunity for rehab at the right
yeah,
time. Now, that is an issue, isn't it? Rehab is most commonly associated with early to mid-stage dementia, isn't it? Less so for
yeah.
people with more advanced stage dementia. But I have heard some people say, do you know what, there is still benefit as dementia advances. The goals change and what's needed changes, but there is still benefit. What is the approach for you guys in Scotland? Is it around very much early to mid stage, or is there some offering for everybody?
Um, I would think it needs to be for everybody. I think when you go into the website and look at those AHP resources, we probably have gone too much upstream. So people are, I know our carers group, and I've said to actually what's missing from all these resources. They've asked for more resources for advanced dementia when somebody's at that stage. So we'll begin to address that and look at that over the next sort of 12 months. But I think rehabilitation should be all stages. And yeah, it should be all stages. We do that for other conditions. We don't wait. It should be offered, whether it's supporting somebody in their seating or sort of pain management, Beth, or supporting the family carers or the main supporter. Yeah, I'm quite ambitious. I think it should be all stages.
Yeah,
Um,
and
and
I'm
it,
absolutely with you on that. Why would it
yeah,
not be?
yeah,
As I say, there's clear rehabilitation pathways for people after, for example, a stroke,
yeah,
and that could be offered no matter where you are
yeah,
with that.
yeah, absolutely.
Someone's pointing out England has a salt issue. They're not talking about salt and pepper. They're definitely talking about speech and
Yeah,
language. I think that's been the case for years. That was the case when
yeah,
my dad was alive and he died in 2012. There are long waits for speech and language for many people, and we need more lovely speech and language therapists out there who can support people living with dementia. Someone saying, I love the home-based rehabilitation program. As an OT student, it feels so person-centered, and I feel I'm really helping. Can't get
yeah.
better than that as a student. That's
No,
what keeps you going forward.
absolutely, absolutely, and it works.
I'm trying to look for some questions. I think most of these are statements, but they're still worth looking at. I'm using HBMR on my placement, and you can really see the difference it makes in early diagnosis and encouraging early rehab. George makes the point many memory services do not understand cognitive rehab, so
Yeah,
they don't offer it. I think
yeah,
that is true. Now, I saw yesterday that the Memory Services National Accreditation Programme, I do some work for them, as does George. They are going to run a webinar based on the World Alzheimer's report
yeah,
to aimed at memory service professionals. So I would very much encourage people to go and have a look at that. It's open to everyone. You don't have to be an MSNAP member to go along. If you're working in memory services, diagnostic services, that would be a good one to go to, and it's free.
yeah.
Um, Thank you, great resources. Ruth says, I wonder if the word rehab is now outdated in the NHS, still considered in terms of conditions which are easily recoverable, e.g., strokes, fractures, work to be done for teams or services. Do you think there's an issue around the language, Elaine?
It's interesting because our colleagues in Australia, they call it reablement. But actually, when you look at what makes rehabilitation, and particularly, do you know, Mary Marshall wrote about rehabilitation in dementia in 2005. It's like it's not a new term. I don't think it is outdated. I think it's not a terminology we naturally associate with dementia. But then when I came into post in 2012, people didn't think self-management and dementia were a connection either. So I don't think so. I think we need to, our other colleagues that aren't dementia specialists understand it when they talk about stroke rehab or other neurological conditions. Yeah, so and we have a rehab framework in Scotland, so we're embedding that work within that wider policy. So that's where, for me, the policy context key, because I think it for us in Scotland it isn't. Yeah, and I think Wales has got a rehabilitation framework as well. So, yeah, I'm going
So
to
for
stick
you,
with
the
rehabilitation.
language phase, we're going to keep with that. Absolutely.
Yeah,
Okay.
yeah.
Let me get back to, I'm just kind of trying to find that link for the MSNAP webinar because I think it'll be really useful for people. So I will find that before we finish up today. We're almost at the end. Many thanks for an informative presentation. How do the different AHPs work as an MDT team for people with dementia?
I think in Scotland it'll really vary in numbers. Um, when I look around Scotland, the numbers that you're going to have in each team will be really different. You would hope there's access to or sessions at least from, you would hope it's made up mainly of occupational therapy, dietetics, speech and language and physio, and access to podiatry, music therapy and art. So it's each board in Scotland will do it differently as to who's in each team. Obviously working alongside nursing and medicine, social work and psychology. Um, it's just really different.
Super. Right, I'm just popping that link in the chat now for anyone who wants to go and to the MSNAT webinar. That event is also on our events page now as well. If you don't grab the link before the end of today, head to our website, Journal of Dementia Care.co.uk, and you will find it. Right. Okay. Let me just get back to the questions. I think we're almost maybe have time for one more. So I agree with reablement. Rehabilitation sounds like you can recover. What work is being done to ensure the lived experience is always clarified into actually diagnosed and those whom are supporting? I think you've answered that, Lynn, because you work with two separate groups, you said, didn't you? So
Yeah.
I will leave that question. And I think we've got to about the end of the questions. Lots of people saying it's been really useful and really, really helpful. And thank you so much, Elaine, because I think it really has been very useful. The last comment on the chat there was thank you for sharing all the important work that you're doing. And I think it has just been incredibly useful. So thank you so much, Elaine. I really appreciate it.
Thank you.
Thank you. So do get in touch with Elaine if you would like to find out more about the fantastic work she shared this afternoon. Remember, when you look at the recording, you will see all the slides available for you to have a look at, and all Elaine's contact details, lots of social channels as well as the traditional ones as well. So what remains is for me to say thank you so much for coming along today. I appreciate all the lovely thanks in the chat. It's been fabulous to spend the hour with you all. So I wanted to tell you about our remaining webinar programme for 2025. So we currently have 4 webinars available for you to book onto. More will be added to our winter programme soon. I'm already starting to book into next year as well, so really exciting. Lots of webinars will be upcoming as the months go on. Do follow those links in the chat to reserve your places. Do follow us on our Eventbrite page. That's a really good way to find out as soon as a webinar gets posted, and you can go grab your ticket for it. But for this afternoon, thank you so much for coming along to this webinar, and thank you again to our speaker, Elaine Hunter. Thank you.